Ewing sarcoma. Almost all Ewing sarcoma is over. Ewing sarcoma is children in the diaphysis, marrow tumor, and the thing is, the peculiarity is it will have constitutional symptoms also. It may produce constitutional symptoms. It mimics the osteomyelitis. And the peculiarity is it not only sends metastasis to lungs, but also to the other bones. Not only to the lungs, but also other bones. So the peculiarity of the Ewing sarcoma are bone-to-bone secondaries mimicking the osteomyelitis. Bone-to-bone secondaries mimicking the osteomyelitis, tumor with constitutional symptoms, children. And highly sensitive to radiotherapy. This point lala, you should have in tips. Yes? Yes? Radiotherapy. Melts but recurs again. It melts like anything but recurs in the same way. Now the Ewing sarcoma. 15 to 50. Femur, tibia and flat bones. This is a specific here. Flat bones. Femur, tibia and flat bone. Diaphysis and marrow. Sheets of round cells. Monotonously arranged sheets. Where in the single way all sheets will be like this. If you see it, it will become monotonously boring. There is no design, only sheets like Ramco fabric legs, sheets of round cells, polyhedral cells, round cells, and sometimes there may be pseudo-recede formation, central necrosis followed by the cells. But however, the constitutional symptoms mimics the osteomyelitis, and moreover, even though it produces new bone on the shaft of the diaphysis, many times it produces lytic area in the flat bones. The difference is Ewing sarcoma occurring in the long bones is what is called, in the long bones it will produce onion peel appearance. The same Ewing sarcoma if in the flat bones like calcaneum, scapula etc., it will produce lytic areas. In long bones, onion peel. In flat bones, lytic area. So, lytic in flat bones, and one more thing is bone to bone secondaries. Bone to bone secondaries. Children mimics osteomyelitis, constitutional symptoms, the onion peel appearance of new bone in the diaphysis area, but bone to bone secondaries, lytic in flat bones, and then what's called mimics the what's called onion peel appearance. All these are typical characters. The treatment is mostly chemotherapy. Even though radiotherapy is there, but it recurs again along with surgery. So Ewing sarcoma, read again, highly malignant tumor, 10 to 20, mainly in the femur long bone and tibia, 1/3 occur in flat bones, usually in the pelvis and calcaneum. Diaphysis of the long bone is the most common. Periosteum elevated, subperiosteal new bone formation, often in layers, that is onion peel appearance, but in flat bones it will be later. The tumor ruptures through the cortex early and enter the soft tissues. That is Ewing sarcoma. Etu pakka undantav? Left side. Ewing sarcoma. Ewing sarcoma. Ewing sarcoma. Ewing sarcoma. ఏలు ఊగినట్టు కూడా ఉందేంటి? Histopathology. So the tumor comprises of sheets of quite uniform small cells. అందరు షీట్లో కూర్చొని సైలెంట్గా కూర్చొని చూస్తున్నారు, బోర్ కొడుతుంది. In the same way, there will be sheets of quite uniform small cells resembling lymphocytes. Often the tumor cells surround a central area, forming a pseudo-recede. If there is in the central area, if there is a nerve cell, and then there will be what is called neural element or crust element, and then cells are around it, it is recede. But if there is no cell in the center, only degenerated part, and cells are there, that is called pseudo-recede. That will be there in the neurocrustal tumors. Recede will be there in the central neural part surrounded by the peripherally cells. Here there is a necrotic area and here it is called pseudorosis. Pseudorosis. Often the tumor cells surround a central cural area forming a pseudorosis. See this one? Most cases show necrosis at least focally, pink necrotic cells in the center and the high mitotic rate surrounding it. These solid tumor clusters are separated by fibrous bands. Solid tumor clusters separated by fibrous band, you can see. The tumor grows fast, metastasize to lung, like osteosarcoma, metastasize to lung. However, it also produces bone-to-bone secondaries. Bone-to-bone secondaries. Some people will say bone-to-bone secondaries are not really bone-to-bone secondaries. It is multicentric cause. They think that the Ewing sarcoma has occurred simultaneously in the same places. Simultaneously in the same different places. May not be bone-to-bone secondaries. That is a controversy. But for your level, remember, bone-to-bone secondaries is a character of Ewing sarcoma, along with fever, constitutional symptoms, and then onion peel appearance. Bone-to-bone secondaries are very common. See that one? Most frequently asked question. Clinical features, presents with pain and swelling. Often there is an associated fever and constitutional symptoms. Confused with osteomyelitis. Confused with osteomyelitis. Then radiological features are lytic lesion in the medullary zone of this because it is in the medulla, and then cortical destruction, new bone formation, cortical destruction. This is what is called cortical destruction, this is cortical destruction, and then layer after new bone formation. See this original X-ray, there are layer after layer, and that is what is called onion peel appearance. Here also you can see the layer after layer onion peel appearance. So layer after layer onion peel appearance. Atypical presentation. Sometimes what are the peculiar characters of Ewing sarcoma? It may be confused with osteomyelitis. Tumor may be located in the metaphysis, though it is diaphysis, atypical. Have a predominant soft tissue component with a little cortical destruction, so it mimics soft tissue sarcoma also. Sometimes predominant soft tissue may mimic a soft tissue sarcoma. In flat bones, primarily a lytic lesion. In the flat bones, there is no new bone formation. With hardly any new bone formation, it is primarily a lytic lesion. Ewing sarcoma can be differentiated from the osteomyelitis et lamari. If both are confusing, how to make the confusion liquefied? Sequestrum. In osteomyelitis, sequestrum will not be there. Well-defined cloaca and rather smooth periosteal reaction located in the metaphysis. Usually, Ewing sarcoma is in the diaphysis. This is in the metaphysis. Sequestra will not be there. Cloaca will not be there. If they are present, they are osteomyelitis. Treatment, highly radiosensitivity, most quickly cures but recurs. In most cases, distant metastasis has the control by the 60,000 rods, control of metastasis by chemotherapy. Chemotherapy consists of vincristine, cyclophosphamide, adramase, etc. Prognosis is poor. So 5 to 15, femur, tibia, flat bones, diaphysis bone, sheets of round cells monotonously, constitutional symptoms, mimics the osteomyelitis, lytic flat bones, bones to bone secondaries, onion peel appearance, amputation, multi-drug therapy, chemotherapy. We will stop at this section.